Hello, my name is Angel, and I'm going to be talking about why talking helps and the psychology of therapy and the the science and why the frontal lobe is so important in everyday life. To start off, I'm going to be talking about why therapy. I want to go into therapy, and I feel like it's something that I would see myself going into because I like listening to people. Been told I'm a good listener. I give people good advice. I always felt accustomed to help people out, have had people who barely even knew me open up to me. And I think I can see myself doing this in the future. And ever since I've been talking to people and having and listening to them, I realized I had a passion for it. And I could see myself doing this for years. And now I'm going to talk about a study that involves the frontal lobe called How CBT, Cognitive Behavioral Therapy, Changes the Brain in Depression. So, CBT increases activity in the frontal lobe regions that control emotions. Better therapy equals stronger brain activation during emotion regulation. This suggests CBT improves depression by helping the brain reduce negative emotional reactions. As I go on into therapy, I'm going to find people who are going to need um, cognitive behavioral therapy, and I'm going to know how to detect their emotions and behaviors. And this study shows that this does help with depression. And a lot of people with depression need uh, this type of therapy, and I need to be able to identify this and help people out. So the next study that I found was nocturnal frontal lobe epilepsy. And this is another study which is not similar to the study before. It's more related to seizures. Is this type of epilepsy is a sleep-related disorder with seizures that come from the frontal lobe. Many patients improve with medication, but about one third are drug resistant. So some of them are required to have therapists because diagnosis requires sleep studies, genetic testing, and brain imaging to separate NFLE from other sleep disorders. So this connection to the frontal lobe in therapy is that frontal lobe controls decision making, attention, emotional regulation, and are all disrupted by seizures. And patients have trouble with sleep quality, daytime focus, and mental clarity. So therapists are brought in to help patients who struggle um, with it, with this disability, so they could help restore their frontal lobe. Therapy helps with the frontal lobe become more normal and again improving its original functions. And what will I do with this information? So when I get into therapy, every patient will have their different needs. I can apply what I learned about CBT, cognitive behavioral therapy, and NFLE, nocturnal frontal lobe epilepsy, in my future, whether in my profession or just in daily life. A lot of people I know could use cognitive behavioral therapy, and of course, a lot of people don't like therapy because a lot of stigma around it, but I believe that they hear it from me and they know that I'm a good listener. I think that will help them. And learning about the frontal lobe is important because it is something I'm always gonna have to deal with this go deal with going on into the future. I already deal with this on the daily life. Everyone uses their frontal lobe, but when I talk to people, they use their frontal lobe by expressing their emotions. And going on into therapy, I'm gonna have to identify what they're going through. And the frontal lobe is one of the most important parts of the brain to help me identify this. So that's why the frontal lobe is one of the most important functions of the brain and why I chose to go over this. And that concludes my presentation. Here is my works cited page, and thank you for listening.